Shelby D. Bogney is a human resources and diversity executive with extensive expertise in employee relations, learning and development, talent acquisition, talent management, total rewards, diversity initiatives, and succession planning. Throughout her career, Shelby has held senior executive positions in both the public and private sectors at industry leading companies such as the International House of Pancakes LLC, the Home Depot, McDonald's Corporation, and the Walt Disney Company. She currently serves as the Senior Vice President of People and Culture at the Music Center in Los Angeles, California, which is the third largest performing arts center in the United States. In addition to her professional achievements, Shelby is a 38-year life member of Alpha Kappa Alpha Sorority Incorporated. She most recently served as the Far Western Regional Director from 2020 to 2024, overseeing 77 chapters across 9 states. Among her many accomplishments in this role, she is particularly proud to have established the region's first ever Leadership Institute, aimed at providing members with both professional and personal development opportunities. Shelby earned a Bachelor of Arts in History from Howard University and holds a Senior Certified Professional Certification from the Society of Human Resource Management. She is also a member of the National Association of Corporate Directors. Shelby is the proud mother of one daughter, attorney Lindsay Robinson, and is married to her high school sweetheart Gregory. They reside in Los Angeles. Tonight, we are honored to welcome three brilliant medical professionals: Dr. Amanda Patterson, Dr. Alicia Morehead-Gee, and Dr. Patrice Tully. Please note that we will be recording Shelby's workshop this evening to share with those of you that are members of the Sticky Notes group. And if you're not a member just yet, we'll share the contact information at the end of the call so you can join. Now, I will turn it over to Shelby so that we can all learn how to work well.
Thank you, Erica. As many of you know, the goal of my Sticky Notes group and these presentations is to provide timely, practical information to support your employment and career journey. Tonight, however, I wanted to shift our focus to an area that has become increasing concern for many of us, and that is healthcare. With the benefits open enrollment period already underway in most organizations, we're all feeling the impact of rising healthcare costs and even the challenge of affording basic healthy foods. That's why I'm especially grateful to welcome three phenomenal physicians this evening. They are here to dispel common myths and to guide us as we navigate the choices and complexities ahead. I'm truly glad to have you all here, so let's get started. All right, my esteemed panel, to start us off, could each of you introduce yourselves, share your area of medical expertise, and tell us one thing you wish every patient understood about their health? And we'll start with Dr. Patterson.
Thank you so much, Sora Shelby, for that warm invitation and for being here. And to all of us that are on tonight, my name is Dr. Amanda Patterson, and I am a board certified family medicine physician. And I would always say that my actual purpose in life and career trajectory is really to encourage people to live their most abundant lives in mind, body, spirit, and wellness. And I do that under my platform and wellness brand of the Live Well Doc. But I'm also grateful that my 9 to 5 aligns with that too, as a full-time primary care physician with Sonicare, which offers insurance for small businesses. But then we do offer the virtual health platform as a concierge primary care. And so I love that question. One thing that I wish that I'd share with my patients, the new word for tonight, epigenetics. So that just means that although we can have a predisposition for certain health conditions, there are certain lifestyle and environmental factors that can turn on and off these conditions. So when I think about that, like type 2 diabetes, I have a lot of patients that'll come and say, Doctor, everybody in my family has type 2 diabetes. I know I'm going to get it. And I encourage them to let them know, yes, just because type 2 diabetes runs in your family does not mean it has to run into you. And there are certain lifestyle things that we can do to make sure that those genes are actually turned down or not regulated in that way. So yeah, I just would like to encourage people to understand that epigenetics term, that we really do have a lot of control of what happens in our body, especially when we think about chronic health disease management. Thanks so much.
Wow, thank you, Dr. Patterson. Epigenetics. I learned something already today. All right, how about you, Dr. Tully? What continues to evolve in I'm sorry, what would you like for your patients to know? And tell us a little bit about yourself.
Yeah, good evening. Thank you, Sir Shelby. I really appreciate the opportunity to be here. My name is Dr. Patrice Tully. I'm a board certified family physician practicing at Women's Health, TIA Health. I was active duty, took care of Marines and sailors when I was an active duty Navy medical officer myself and transitioned to civilian practice. And so I've taken care of people in really broad areas. And across various areas of primary care and medicine, I would say the one thing that always rings true, and I wish patients knew, was that the most important thing you can do is find a primary care doctor who listens to you. Because if we've seen some public examples of how awful outcomes occur when someone is not heard. And we can't always choose our interactions in the ER and emergency, but at least your primary care doctor should be someone who listens to you. And from there, you have the foundation of a really good relationship. And if your PCP doesn't listen, I'd recommend you find another. That'd be my first nugget of advice.
Thank you. And Dr. Morehead-Gee, would you also share your area of medical expertise and tell us what you wish every patient understood about their health?
Yes, so thank you for having me, Sarah Shelley. I am Dr. Alicia Morehead-Gee. I am a board certified internal medicine physician, which means that I practice primary care for adults only. My area of expertise is really in HIV prevention. Also, I'm a beginner expert in gender affirming care, and I work at Ultimate Health Services where I train our primary care providers about inclusive care, which includes HIV prevention, gender affirming care, and providing a welcoming clinical environment to anyone who presents for care. My main thing I would love everyone to know about is the social determinants of health. There's been a lot of research and articles relate about those. So social determinants of health are the conditions that affect our health that are not traditionally thought of like medications, but it's more like where you work, where you live, your education and things like that. And those actually have those social factors actually contribute to 80% of the impact on your health compared to clinical care, which only contributes 20%. So when I'm talking to my patients, it's usually only for 15 or 20 minutes and then they go out and live their lives. And so the time that you spend outside of the doctor's office is actually more important than your time in the doctor's office. Of course, it's important to be listened to. I agree with everybody, what every panelist has said today. But it's also important to take into consideration your daily life outside of the doctor's office and how it impacts your health.
Right.
Yes, thank you. Yes. All right. So this next question is for you, Dr. Patterson. As healthcare continues to evolve, what developments in preventative care give you the most hope?
Yeah, that's an excellent question. I think that being in the space of virtual healthcare, it's the idea of how we're going to leverage technology. So it's really exciting for me when we think about access to care, of how we're using telemedicine services. And, that was something that was introduced, perhaps the only golden nugget that came out of the pandemic, that silver lining that came out of there. But I also think too that we're having that opportunity where we're putting prevention options in patients' hands right in their home. So I think about like colon cancer screenings, perhaps about 15, 20 years ago, it was just colonoscopies. You had to go in for that colonoscopy. It was a procedure, but we knew that that meant you had to take time off from work from that. And, there are some complications that perhaps very low risk. But now we know that there are options like the Cologuard test, which is an at-home test that, we think about colonoscopies are about 97% effective at catching colon cancers. For an average risk individual, the at-home test is about 93% effective. And so I feel when we think about prevention, that opportunity of expanding access and also the cost shift of that, of moving from a procedure to an at-home test, I'm excited to hear where else we're expanding that, not just for colon cancer, to see how we can definitely bring more access to prevention to our patients.
Yeah, access is key. That's awesome, and there it reduces the barriers to trying to get the test done. Yes, Dr. Tully, we're seeing healthcare costs rise year after year. Lord knows it's gotten out of control at this point. From your perspective, what are the biggest cost drivers that patients should be aware of? What's really pushing the cost up?
Great question. One of the most significant drivers of healthcare costs, interestingly enough, isn't healthcare at all. It's administration. And those who take care of patients every day, like us, physicians and nurses and respiratory therapists, and everyone who lays hands on a patient, we represent a really small part of healthcare costs. A significant amount is actually in administrative high-level executive salaries. We're learning a little bit more about, the insurance business model. So that is one unfortunate area that drives a lot of costs. Also, highly specialized care. So primary and preventive care is actually the most high value care. So it doesn't cost a lot to do most preventive screenings and to see your primary care doctor and get a preventive exam. They're pretty low healthcare costs associated with that. But it's actually the highest value form of care because that's how you find things early. And as Dr. Patterson said about screenings, really things like screenings and expanded screenings that find conditions early are the lower cost part. I was once told that most of our healthcare dollars are spent in the last 6 weeks of life for largely futile care. So usually high level care, going to the ICU, seeing a lot of specialists when you're very, very sick. That is the most expensive kind of care. But going to your PCP and getting your physical and or doing your Cologuard screening at home and finding it's abnormal and finding early colon cancer, that is the low cost, high value part of healthcare.
Wow. Yes, thank you. So important to know. And Dr. Morehead-Gee, someone trying to build healthier habits on a tight budget, for someone that's doing that, right? What are key areas they should prioritize? So if I'm trying to make my budget stretch, but I need to be healthy, what are the things that I can do?
There are a lot of options. First, you need to know about your own medical history, be in tune with that, and know your family history. If you're able to ask your family members about their medical issues, especially any history of cancer, those are things that you need to know because they could impact your risk of any type of cancer or other medical condition. So it's good to know your history. And then beyond that, it's in your daily habits. So looking at what you're eating every day, how much you're moving every day, those make a big impact on your health. We've mentioned diabetes here, um, hypertension or high blood pressure, high cholesterol. Those things can be impacted by genetics as well as lifestyle, as Dr. Patterson mentioned. And so if you know that your family members might have these medical conditions, you can help fight against your genetics, like Dr. Patterson mentioned, by looking at what you're eating, making some changes and making realistic changes, not just doing an extreme diet that is going to be hard for you to maintain for the long run, but looking at, oh, hey, I drink a soda every day. Can I cut that out? Or I have this extra time 20, 30 minutes during lunch? Can I go for a walk? Can I do those things, little things that are realistic for me to keep up every day or keep up a routine for? Those will be the most impactful for your health. In addition to just a quick plug to avoid like tobacco, like smoking, that has a really bad impact on, heart attack risk and your lungs and things like that. So looking at what can I include in my daily habits and what can I take out that are gonna be things that are realistic for me to maintain so that I can help my health overall.
Thank you. Dr. Patterson, I think we always hear about what Dr. Morehead-Gee said about, get your exercise and eat well and, cut out the sugary drinks and those types of things, which, we know that those are good preventative measures. What else would you say to us about other habits, any other habits that even if it's in being in the habit of getting your physical, whatever it is, what other habits can we, sort of take on that would help us with wellness and with our health?
Yeah, yeah. So I have to echo my soror, Dr. Alicia Morehead-Gee. She brought up those things. I have like four components that I always encourage my patients. Like if you can touch these areas, your life will be less of a mess. It's also just having that understanding that that's the human experience of having messy. That's the human experience. So perfection, we're not working towards that. But if we can move well, we can eat well. We sleep well. And I think we forget about the importance of sleep. And we're also seeing that all those things that it impacts as we're thinking about not just our metabolism, we think about how that can even affect as we're aging our cognitive health too. So considering that, and that last one is to stress well. So what does that mean? Like, stress. Again, stress is a part of the human experience, but when stress does come, how are we going to allow that to impact us? And that really taps into that mental health component. And so I say we cannot wait till the storm comes, then to try to get things together. These are daily practices that we really need to think about. What does stress management look like? So community. What does your community look like? Do you lean on them when you're having stressful moments? Do you have somebody, a mental health provider? Also, a lot of in our insurance plans, a lot of them do have access at least to like 8 to 12 sessions sometimes with a behavioral counselor. Talk to your insurance plan to see, hey, if you can't afford a therapist, see what's already covered within your plan. And then also, too, again, leaning on our community of our faith practices. So I'd say if you can handle those four areas, your life will be less of a mess. So consider those as your daily strategies for living well.
Well, I think if anybody knows what it's like to be stressed at work, it would be any of you on this panel. But since I do have a working group here, those who are experiencing stress in the workplace, do you have any of your own personal techniques when you've got 50 things coming at you and patients you've got to see as well? And what do you do to sort of relieve stress when you're at work?
Yeah, so I think one of those practices that I have built is that I always say I want to pour into my cup first before I pour out. So anything that I'm doing outside for at work, for family, for friends, is the overflow because I've started out my day making sure that I've handled myself. So that starts the night before. I don't play about my sleep. My family and friends know when that D&D do not disturb comes on. You need to call Dr. Jesus because I don't know. It's not what I can do after 10 o'clock. Okay. So that's the first part. And then even in the morning, I'm going to have some type of movement. Let me get my body moving and, having a level two of that spiritual practice of let me make sure I'm starting the day with gratitude, with prayer, with devotion. And so all of those things that helps me in the way that I'm coming into the day with a level of peace. So even when the storm comes, maybe the patient who is a little disgruntled. It doesn't have anything to do. It's just like things that are going on in their life. But there are areas where I can say, hey, I'm going to pour from the overflow and making sure that I am not depleting myself in that way.
Yes, thank you. I have to say to the whole panel, I have a confession to make. I am not, although I am sleepy, I don't always get enough sleep. And it's not that I can't sleep, it's that I'm not getting in the bed, right? So I have got to work on that for 2026. before it's too late. But thank you so much. Dr. Tully, are there any community resources, or employer programs, or lesser known services you'd recommend that we can that can help people who are maybe trying to make their healthcare dollars stretch, or maybe they don't have any healthcare right now? Is there any services or community resources that you know of?
Yeah, a great question, especially in these times. Fortunately, we're in California where healthcare options are about as equitable as I guess they can be and realistically. So there's LA County Department of Health, which is a really good resource. My Health LA as well. From the federal government, the CDC.gov is a really good source for just general information and guidelines. But I would say in California, our LA County Department of Health, and My Health LA. Also, as was said, for those who have health insurance, a lot of health insurance plans have some resources like um, nutrition programs, weight management programs, in-network providers. And I think starting with your health plan and finding out what are covered services, and then sometimes using certain preventive services, you can lower your costs because the incentive is doing basic healthy things makes you a healthier person and a lower risk to be insured. So starting with your insurance plan, and then also we have a good county public health department as a resource too.
All right, thank you. And okay, this I need to ask this question because I want to make sure that our audience gets an opportunity to ask you everything. I'm sure they have a lot, but I do want to know, should we be getting, if we had them before or didn't have them before, should we be getting COVID shots, COVID boosters now? Is that necessary or is it just all gone?
That's a really good question that comes up. The guidance has been that boosters are strongly recommended for those who are considered more immunocompromised. But the thing is, even for those of us who aren't, we are in contact with people who are potentially. So part of our the reason why we should be vaccinated for everything is not only protecting ourselves, but there's some people who cannot be vaccinated because they have certain autoimmune conditions. So they really rely on what's called herd immunity, which is that if most of the population is vaccinated, the few people in the herd who aren't are still protected. And that's something like maybe 95%. And in areas where vaccination rates drop, it ripples through, including those who are, they're not being irresponsible per se. They cannot, because of their health conditions, be vaccinated, or little babies under 6 months, or others who we want to think of protecting. So as far as COVID boosters, the guidance has been a little conservative in that, people, if you had your initial COVID vaccinations and you're otherwise healthy, you don't necessarily need a booster. But I would say we know how protective vaccination is. There are diseases none of us have ever seen because vaccines work so well, that are actually creeping back because more and more people are deciding not to be vaccinated. So I would say go ahead and get the boosters, get the flu shot for the fall. Find out, there are different ages at which we are supposed to get certain things in a certain interval. So, like our tetanus shot every 10 years, and shingle shot when you reach 50, and things like that. Know what those are and be vaccinated for our protection and for those around us.
Yes, thank you. And I know, having a number of employees that work for me, I do encourage, we held a shot clinic and I'm like, please go. Because you do actually wind up getting a lot of things at work, right? And so thank you for that. Well, I want you all to have the last word before we open it up to Q&A. So finally, with the last word, you already said there's one thing you wish that each of your patients knew, but what about one piece of advice that you would give to anyone who's trying to manage their health and be healthy? What's one piece of advice that you may give it to everybody? And I'll start with Dr. Morehead-Gee.
It's tough for me to limit it to just one.
I know.
I I'm just gonna put two in one,
Okay.
if that's possible. So
Fine.
just considering the issues, especially facing the Black community, medical racism, feeling unheard, uncared for when you go to the doctor. There are a couple of things that I know I do because I've had similar experiences as a patient doctor. One is if you went to a university or you have any affiliation with a university, a subtle way to garner respect, which is this is unfortunate, but a subtle way to do that is to wear your university sweatshirt or some type of paraphernalia so that your doctor can see, oh, you went to this college. Um, it's just a subtle way to improve your rapport. If it's a new doctor, you don't know. So that's one thing. The second thing is typically humans in general, get overwhelmed if they get more than three pieces of information. So when you see a doctor, try to limit your concerns to three things. If you have other concerns, then you may be able to address them depending on what's going on with your doctor. But if you can limit it to the top three things, that's how you can more guarantee that your doctor is going to actually hear what you say and take care of what you say because it's less overwhelming for them. And so those are the two things I wanted to put in one, and one more to put in there. It's just a healthy skepticism. So I know that there are things out in the internet. There's a lot of information there, and I think that's great. I think it's great to learn things on your own. If you do not feel that your doctor is giving you the right care, it's okay to have that healthy skepticism and go see another doctor, go get a second opinion, get care elsewhere if you're feeling like you're not getting the right care because doctors are humans and they're not going to always be able to give you the best care. So you have to take it upon yourself to go get it elsewhere if that's the case.
Yes. Oh, thank you. That is great advice. I love the wear your college t-shirt.
Yeah.
I love that too. That's a great piece of advice. Thank you, Dr. Morehead-Gee. Dr. Patterson, same. What is the one or five things that you would advice you would give?
Yeah, I'm so in agreement. It's so hard. There's so many things, but I would say when we're going to those annual visits, your prevention, primary care preventive visit, as Sora Dr. Patrice mentioned, it's so important that you have a PCP, that you're taking advantage of that annual visit. The one question I want you to ask your PCP, what is my prevention plan? For this year, what is my prevention plan? And so that should include cancer screenings and then also knowing your numbers. So walking out of that visit, those are the information you need to walk out with. What cancer screenings am I due for? And then also my numbers. So thinking about my blood pressure numbers, if an A1C or a fasting glucose was done to screen for type 2 diabetes. And then also thinking about your cholesterol number, specifically that LDL. So start with those kind of three values. I think that'll set at least just for that thing where you can now work for and be in a little bit more of a partnership in your health too.
Great. Thank you. Thank you so much. And Dr. Tully, I don't think you got to give your one or five, your piece of advice.
Okay, yeah. Well, my brilliant sorors took all the great answers and made really, really good points. And I would just reiterate the value of prioritizing and what Dr. Morehead G said about coming into a visit with like what's most important to you, because also related to insurance, doctors are squeezed for time. The business of healthcare model requires we see a certain number of patients a day. People only have so much time, and so you get the most out of an interaction by coming into the office and having an idea what are you most worried about and leading with that. And then if other things don't get addressed, you know that what's most important to me, you lead with that because time can be so limited. Um, the other thing, which has also been said, is the value of screening. So, the mammogram starting at 40 or earlier, if there's family history of young age of diagnoses, colon cancer screening at 45, um, prostate cancer screening at 45, annually checking all those big cardiovascular risk factors. We know that the leading cause of death is heart disease, and most of our chronic conditions are all related to heart disease, including dementia. We're learning that those heart health risk factors are also our dementia risk factors, our blood sugar, our diabetes, our cholesterol, blood pressure. And so I would say, as far as screenings go, they are so significant because the survival rate for many cancers found at stage 0, stage 1, breast cancer found around stage 0 localized has nearly 100% survival rate. Other cancers, similarly, 90% for colon cancer, prostate cancer. Those drop precipitously in later stages to like 20% and 30%. And so doing those screenings on time, catching things early, our healthcare system is pretty good at interventions early on, and it really saves lives. So starting those screenings on time, finding out what they are, getting to the doctor at least every year to make sure you're doing them is one of the most important things we can do for our longevity, and telling our loved ones to do it too.
That's right. And spreading the word. And hopefully we're doing that here for those of you who are on this call. Please share the information. I don't know when we're going to have an opportunity to have such esteemed panelists all at once, all these amazing doctors to be able to tell you they're involved today. They are working in the medical profession today. They're seeing the issues of today. And so I really appreciate you all. Again, I don't want to take up too much more time because we have time for a Q&A, and I know that our audience wants to hear that. So I am going to turn it back over to, oh no, I'm going to turn it over to Whitney, who is going to help us through our Q&A sessions. Whitney.
Good evening. We have a few questions, and I encourage our guests, of course, whoever would like to answer, please do so. The first question, which lifestyle habits have the biggest long-term impact on an individual's health?
I'm raising my hand like I'm in a classroom because I know that my other SOR doctors have really good answers. But mine is always nutrition. What we eat, like food is medicine, food is life. Even more important than and exercise is so important, but it said, you can't outrun a bad diet. What we eat and consume, lean proteins, complex carbohydrates, cutting down on all these processed sugar from the American food supply. The single most important thing we can do is manage our nutrition. It's my answer.
All right. Anybody else on the panel? Would you like to address that? Did she do it? I mean, each of you is like amazing. Okay, Whitney, we
Yeah.
can go on.
Dr. Tully, as a follow-up to that, are there any resources that you could share or where you could direct people so they could understand better where they can find out about more nutritional options?
Oh, yeah. So, a couple of things. I would say, starting with a nutritionist, and usually health plans will cover some sort of a nutritionist dietitian care. Um, Even with that, there are apps that help you track your nutrition. So like myfitnesspal.com is one, and Noom, there are others, and they're free. They have like premium versions they try to upsell. But you start by just plugging in if you have any particular goals, like sometimes people use them for weight loss goals, but they're just good for nutrition goals. You plug in what you eat and it tells you what you're getting. Are you hitting your goals, like enough protein, enough calcium, too much saturated fat? So a simple thing, so many of us walk around with smartphones. So you download just a food tracking app, plug in what you eat, and you get a lot of data and information and even guidance from just those apps. And then actually working with a nutritionist or a dietitian, even if it's just a first consultation to give you guidance.
Great.
Thank you.
Can I add one more? I mentioned smoking cigarettes earlier. If you smoke, or if someone in your family, someone you know smokes, their biggest lifestyle uh, change that can impact their health is to stop smoking. That is like the biggest thing. If you're not smoking already, then that's great. But for anyone who knows someone who smokes, um, it would be good to let them know, I think most people think about lung cancer when it comes to smoking, but actually smoking has a huge impact on your risk for heart attack or stroke. And so the sooner you stop, the better your outcomes are. And there are medications and there's treatments for people who have trouble stopping because it's not easy to quit, but it is something that everyone should know.
Yes, and just echoing what was mentioned, another resource is the American College of Lifestyle Medicine. I am a huge fan of a lot of the patient-centered information, especially around nutrition. One of the parts there too that we have found, the data is showing that having more of a plant-based diet because of the higher fiber content in there, that is positively impacting in terms of longevity and even disease reversal for we're thinking about a lot of our chronic health conditions. So you don't have to go totally vegan. You don't have to go that far, but even just incorporating more plant-based meals, that there is a positive impact there. And I found that American College of Lifestyle Medicine, you can just Google their website. They have a lot of resources for that.
Thank you. For those of us leading teams, in what ways can we encourage wellness, in particular mental wellness, without violating HIPAA? Specifically looking for ways to encourage people beyond EAP.
I can add some things in there. So this can be difficult. I can say from a personal perspective, when I was in residency, everyone in residency was probably depressed at some point because the work conditions were really bad. That's just how residency is. And so sometimes they would try to do anything they could to try to make us feel better, but ultimately our work conditions were not good. So first, it's definitely great to check in with your team and make sure, you know, their work conditions are good. I'm sure Sora Shelby can give more information on that aspect of things. But otherwise, when it comes to wellness, there are a lot of benefits to yoga, to meditation. Uh, they both they have that mindfulness aspect in them both. With yoga, you're actually moving your body and practicing the mindfulness. And so if you want to have a yoga instructor come by and do like in the chair yoga, you can do that via Zoom or in person. Uh, I think that that's a nice group activity to foster wellness.
Fantastic. Did we lose?
Okay, thank you. Which lifestyle changes have the strongest evidence for reducing perimenopause symptoms?
So I think there's we're getting more information about this and I think the research behind it, but one, we cannot talk enough about nutrition, right? And one of the things I do counsel my patients is we're getting to that season. Instead of seeing menopause as like this dreaded part of life, let's embrace it and let's actually prepare our bodies for it. So one is really considering where can we get more protein in our diet. So one of the things that we understand in terms of menopause that we do end up losing a little bit of muscle mass and bone mass. So we want to see where we can actually help to preserve that through two things. One, nutrition, as we think about protein, but also as we think about movement and actually is that resistance training. So ladies, I need you to pick up some heavier weights. Let's move from the 1 to 2 pounds. We have to pick up some heavier weights there because that's actually going to help. And it's not just as we're thinking about the physique of, maintaining muscle, but even as we think about the longevity for our bones, less fracture as we get older, and that's one of the complications that we see. But also as we think about that movement component for our heart health, that's a long-term contribution too that we'll see. So definitely as we think about those lifestyle changes, really focusing on muscle preservation and bone mass preservation through diet and exercise, specifically that resistance training is important.
Thank you. And continuing on the topic of women's health, what are the latest evidence-based recommendations for perimenopausal and menopausal women who cannot take HRT?
I guess I'll offer somewhat of an answer. So, There are supplements that we know can have benefit potentially, and whatever the reasons why someone can't take HRT, like perhaps they have cancer history or estrogen receptor positive cancer history or something like that. There are supplements like maca root and evening primrose oil. Um, for example, Vitex, Swedish flower pollen. There are a number of supplements that have some data behind them being helpful for perimenopause and menopause symptoms that are not hormone replacement therapy. And they could be options to help with some symptom relief. But depending on the reasons why someone cannot take HRT, they should always review even the supplements with the doctor who knows their full history. But there are definitely some supplements that have been able to offer some symptom relief.
Thank you. And there's one more question that's related. At age 60, is it important to know your hormone levels after menopause? And if so, why?
Um, I'll offer my best answer, which is so I see a lot of women. I mean, I'm a women's health clinic who span from 18 to 80. And we're learning so much more about menopause and perimenopause. So women are coming in asking questions and seeking help, which is good and long past due. Um, as far as hormone testing, it's interesting because the thought is that after menopause, there isn't necessarily value to hormone testing. Um, Even if a woman is taking HRT, the value of I mean, after all, hormone replacement therapy is for symptom relief, and we usually manage a regimen based on how someone feels and how they're responding more so than what your estrogen or progesterone or testosterone level is. Um, but at least what I've been taught is, and the truth is, all of this is evolving. So we might come to a point where we say, no, a woman at 60s, hormone levels matter, and we should be looking at these things because this is an area. Women's health has a long way, decades to go. Um, but at least as our understanding is now, checking hormone levels, so the definition of menopause is 12 months with no period. Once a woman reaches that point, the thought is that hormone levels aren't necessarily clinically useful, more so how she feels matters more. And the choice to maybe replace hormones has to do with, if she doesn't have a reason why she cannot, if she wants to. Um, and more about symptoms and feeling better and long-term heart health more so than just hormone levels at a point where we assume we know what the hormone levels probably are. At least that's my best understanding as of now. But I think, what we know about these things is changing.
Thank you, Dr. Tully. For someone always traveling for work, what are your top tips for staying consistent with healthy routines?
I can try to answer that as someone who travels a lot for work. I, but I understand it is so hard to stay on a routine when you're traveling. I try to pack some workout clothes for every trip. Now, I don't always use them, but at least they're there so that if I get some time, I can stop by the hotel gym. I've made it like a part of the trip in my mind because I'm like, well, if I'm paying these hotel fees, that actually includes the gym anyway, so I might as well take advantage of it. And the gym, a lot of times, it's going to have free water, free fruit, so you might as well check it out anyway. Uh, Other things are looking at what you're eating. I know I tend to eat a lot more when I'm traveling, especially if I'm at a conference. There's free food everywhere. And so it's tough because I mean, it's very hard to turn down certain things when it's just in your face and it's free. But you may have to bargain with yourself, like say, okay, I know on this date, this is my schedule. I know I'm going to have this big dinner. Why don't I stop by and do 20, 30 minutes on the elliptical or the treadmill beforehand? Let's work in that time so then I'm allowing myself to eat more to make up for it. So it's kind of it's hard to stay on a routine, especially when you're changing time zones. You're on a tight schedule wherever you're going. You want to make the best of your time. So it's up to you to make these little goals for yourself or bargain with yourself and look ahead of time to say, okay, where can I fit in my fitness and my wellness so that I can stay healthy.
Thank you. So another question that we have, how can we best support someone that may have a fear of going to the doctor?
I absolutely love that one because I do believe community is such an important part of wellness. So I think first is acknowledging where the root of the fear is. And especially a lot of times I say, I don't get to reach everybody, all of my patients and their family members, but I deputize them as being community health advocates, asking them, where did the fear start? Is it something that you saw maybe from a loved one or a bad experience you personally had, or maybe a time where you felt dismissed in the medical system? Let's start there, okay? And then even offering, would you like for me to go with you to your appointment? Just as an extra set of eyes and ears. Let's have that plan together. And then also, I'm a huge fan of reviewing your provider before you go. Go on Yelp, read the reviews, Google reviews about them, so that way you get a sense of who they are, what other patients have had experiences about with them, and then going from there. Now, sometimes it's even outside of just the provider personal interaction. It could be actually the medical process in its own, whether it's giving blood or going for a procedure. I've had some women that have pushed off their mammogram, like I'm just too afraid to go through there. So then let's talk about my job then is to let's talk about the risks and the benefits of going for this procedure or going for this health screening. And I think too, just having a family member or a friend or a soror who can be there as the accountability that does help a lot, just to encourage people and just to keep us well as a community.
Thank you. Dr. Morehead-Gee or Dr. Tully, did you have anything to add?
That was a really good answer. Piggybacking on that, I would say maybe if the fear is around the interaction with who you're seeing, you can ask people around you who their doctors are, who they see, and if they're happy with it. Because I mean, I have a lot of patients who a family member saw me and they liked me enough to tell somebody else or a coworker. And so I think when you at least know, okay, this person takes good care of somebody I know or care about, sometimes that can help. Going to familiar places and physicians and providers can take away some of the some fear, which are there are a lot of legitimate fears out there.
And I can add, you may want to, if someone's scared to go to the doctor, they may want to start off with just going to a health fair, a place where it's less pressure. You're not necessarily talking to one-on-one with the doctor, but you can still go get your blood pressure checked. You can get your blood pressure checked at a CBS. So if you want to start off with small things that are still going to have a big impact on your health, look for those health fairs. You can also do telehealth if you're more comfortable with that rather than seeing someone face to face. You can still get a lot of things done via telehealth. Some of my telehealth appointments are literally a phone call. So I've had appointments, like 3 appointments with a person via phone before they even saw me in person, and they thought I was a completely different person based on how my voice sounds. Like I'm not gonna say what they thought I was, but like you don't have to start off in person. You can start off just a few phone calls here and there. You can do the labs outside, like, ask your doctor to order the labs at a Quest lab. Then you just go do the labs really quickly and then build up to that point where you're comfortable with them. You see them in person, and then you might be surprised by who you're meeting. Also, that adds a little fun to it.
Thank you all. I think we have one last question, and that is if someone is thinking ahead and interested in being pregnant soon, what are some best steps they can take today to prepare their body?
guess I'll offer an answer. For one, in addition to all the basics, so getting a physical, basic labs, check your blood pressure, screening for diabetes, just getting ahead of those basic screenings. But then also, I would say something as simple as starting a prenatal vitamin before you're trying to conceive. Because the biggest difference between prenatal vitamins and regular vitamins isn't much except the folate, the folic acid content, and the iron. And that folate is really important for early neural tube development, that brain system development, most of which happens really early in the first trimester before a lot of women know they're pregnant. So if you get that folic acid on board early before you really even start trying, that is one of the most simple, significant things that someone can do. So basic health screenings and starting a prenatal vitamin, and they make really good vitamins. So, there's benefit to taking them in general.
Thank you. Unless either of our other two guests have anything to add, I think that is the last of our questions. So I appreciate your very, very thoughtful and helpful answers for those who asked questions.
Are we turning it back over to Erica?
Yes, we are.
But you're muted, Erica. Oh, you're muted still. Sorry.
Okay,
There you are.
well
Yes.
said. All right, well, thank you so much for joining us. I want to extend my gratitude to our host, Shelby Bogney, and our three panelists. Thank you for this phenomenal and timely presentation. If you have any additional questions or would like to connect with Shelby, I've included her contact information in the chat and on the screen. If you're not already a member of Shelby's Sticky Notes on Facebook, I encourage you to join for more career advice that truly sticks. On behalf of our Sticky Notes team, thank you for spending time with us this evening and have a wonderful night.
Thank you.